What if I told you that over 340,000 Americans could lose their jobs in a single year? And it's not because of a recession or industry collapse. It's because of expiring healthcare subsidies. Texas alone could see more than 83,000 jobs vanish. How did we get here? And what does this mean for you? Millions of Americans are about to feel the pinch. And for hundreds of thousands of workers, it won't stop at rising health insurance premiums. They could lose their jobs entirely. According to a recent study, if the Enhanced Affordable Care Act tax subsidies expire, the U.S. will lose nearly 340,000 jobs in 2026. The hardest hit? Texas, with a staggering 83,400 jobs projected to vanish. Florida and Georgia round out the top three, with 57,500 and 30,600 jobs lost, respectively. That's not just a healthcare issue. It's an economic nightmare. The cost of losing subsidies. These subsidies, introduced during the pandemic, made ACA plans affordable for millions. Without them, premiums will skyrocket by an average of 114%. That's right, more than double. For many, health insurance will simply be out of reach. Nearly 7.3 million Americans could lose coverage altogether. But it's not just consumers feeling the squeeze. Healthcare providers already struggling with thin margins will lose revenue as fewer people seek care. Hospitals, clinics, and pharmacies will be forced to tighten their belts. Some will lay off workers, others might close their doors. Adding to this crisis, the federal government recently slashed the National ACA Navigator program budget by 90%, dropping it from $98 million to just $10 million. Navigators are essential in assisting uninsured individuals through the complexities of ACA enrollment and connecting them to Medicaid or other health programs. The decision to reduce funding hits Texas particularly hard, as the state received $17 million in Navigator grants last year. Without these funds, nonprofits across the state are now scrambling to continue their efforts. Organizations like Foundation Communities will have to cut their outreach efforts and shrink their teams. To make matters worse, Texas, notoriously holding the highest uninsured rate in the U.S. at 17%, is less equipped to handle the fallout compared to other states. Unlike most states, Texas has not expanded Medicaid, leaving millions of low-income residents with fewer options to secure affordable coverage. The ripple effects could hit retail, real estate, and even manufacturing as laid-off workers cut personal spending. Small businesses will feel it. Local economies will shrink. Take Texas. Sure, it's losing 83,400 healthcare-related jobs. But those losses don't stay in a vacuum. That's lost wages, fewer retail sales, and less consumer spending in every direction. Making matters worse, ACA navigators, though often overlooked, play a critical role in reducing overall healthcare costs. By enrolling individuals in insurance plans, they help prevent reliance on expensive emergency room visits and support patients in managing chronic conditions before they escalate. States like Texas, Florida, and Georgia, which didn't expand Medicaid, are at an even greater disadvantage. Many residents in these states depend on ACA marketplace subsidies because Medicaid options are so limited. Open enrollment begins in weeks, and premiums for 2026 are already set. If subsidies were extended today, marketplaces would have to scramble to adjust premiums and update systems. But would extending them still help? Absolutely. It could mean millions of people keeping their insurance. It could prevent hospitals from taking such a deep financial hit, and maybe, just maybe, keep some of these jobs intact. Without action, the economy will take a major blow. More uninsured people hitting the emergency room. Overworked hospitals, thousands of healthcare staff unemployed, and all of us paying the price. When it comes to healthcare, jobs, and stability, these subsidies are more than just financial assistance. They're a lifeline for families, for communities, for the nation's economy. And without adequate funding for ACA navigators, millions of Americans could face the daunting task of navigating the enrollment process alone. Let's recap what we've learned. If ACA subsidies expire, nearly 340,000 jobs could be lost nationwide by 2026, with Texas facing the most severe impact of over 83,000 job losses. Without these subsidies, health insurance premiums will increase by an average of 114%, making coverage unaffordable for millions. Nearly 7.3 million Americans could lose their health insurance entirely. The 90% cut to the ACA Navigator program, from 98 million to just 10 million, further compounds the crisis, especially in states like Texas that haven't expanded Medicaid and already have high uninsured rates. This isn't just a healthcare crisis, it's an economic one. The ripple effects will impact retail, real estate, manufacturing, and local economies as consumer spending drops and healthcare facilities are forced to cut back or close. Thank you for watching our report on the potential impact of expiring ACA subsidies. As we've seen, this isn't just a healthcare issue. It's an economic one that could affect millions of Americans and hundreds of thousands of jobs. Stay informed and engaged as these critical healthcare policies continue to evolve.